Okay, hello everyone. Are my slides coming through? Yeah, great. Okay. Good afternoon, everybody, and welcome to the May seminar of the CFBS Seminar Series. My name is Dr. Marie Henshaw, and I'm filling in today for Dr. Ben Spivak, who usually leads this seminar series, but is on leave this week. Before we begin, I'd like to acknowledge the traditional owners of the lands that we're on today, the Wurundjeri people. They're the traditional owners of the lands on which Swinburne campuses are located and where I'm calling in from today. I'd like to acknowledge the traditional owners of any lands on which you're calling in from and pay my respect to elders past and present, and extend that respect to anybody, any Aboriginal or Torres Strait Islander peoples who are attending today. And my slide is not moving. Okay, so for those who are new to the seminar series, this is a monthly series that the CFBS runs, which basically has the purpose of communicating the latest research findings in correctional, forensic, and psychology and forensic mental health services. You will all obviously be aware of the seminar today, but if you would like to know about upcoming seminars or any other events that the CFBS is hosting, please feel free to send us an email at cfbs@swin.edu.au to join our mailing list. We would love to have you on board. A couple of housekeeping items before I introduce our presenter for today. The session is being recorded and will be made available on YouTube after today's session. Feel free to ask any questions in the chat box. I'll be monitoring that throughout, and we'll save some time at the end, about 10 minutes for the questions to be answered by our presenter. And without further ado, I will introduce our presenter. So today we have a presentation on leveraging technology in forensic mental health services, presented by Associate Professor Ashley Batastini, who is a relatively new staff member at the CFBS, very excitingly. Her work broadly focuses on novel intervention strategies for high-risk populations and ways to improve access to appropriate services at various stages of the criminal justice system. Ashley has numerous early career research awards across different organisations, and central to today's presentation, she's currently a member of the APA's Office of Healthcare Innovation Advisory Committee for Mental Health Technology, and recently co-chaired the APLS Telepsychology Task Force. And prior to coming over to Australia from the US, Ashley was a practicing psychologist specialising in criminal forensic mental health evaluations. So please welcome Dr. Ashley Batastini as our presenter today. I will stop sharing my screen and hand over to you, Ashley. Go ahead.
Thank you. Okay, so my slides were not coming up exactly the way I wanted to, so hopefully I can get these up here without much issue. All right, I think that is visible. Yes, no, oops.
Yes, that's right, we can see.
Oh, I think I lost it. Hang on. There we go. No, can you not see anymore?
It went away.
All right, let me try one more time here. All right, I think that's back now, maybe.
Yeah, that's right. We just need to go into presenter view. Perfect.
All right, here we go. Okay, so I want to just start with a couple disclaimers, some of which are already kind of made aware in Marie's introduction of me. But one of those disclaimers is that I am a psychologist. So there may be some other professions on the call or other people from different subdisciplines, but I'm a trained psychologist, and so a lot of what I talk about is coming from the psychological literature. And then the second one is that I am an American. And so this may color a little bit of, again, sort of how I came to know things and what I know in terms of using technology for various forensic and correctional mental health purposes. So again, I kind of share these things with you to let you know that these are things about me that, again, have led to me sort of understanding this literature and how this kind of applies. But hopefully things are similar enough in our two countries that these things are applicable here as well. The third disclaimer that isn't on here necessarily is that I probably have more slides than I'll actually get through today. So Marie's going to cut me off at about 10 till 5, and we can have a discussion or answer any kind of questions that folks have. So bear with me. I've got a lot of things that I want to cover, but we may not get through all of it. Did folks get a copy of the slides? At least maybe people can have this information available to them in some other format. But if not, you're welcome to email me, and I'm happy to send you anything that we didn't get through today. I want to kind of talk a little bit about what I mean when I say technology. I think a lot of times in especially forensic mental health, when we talk about technology, a lot of people tend to think more specifically about video conferencing, like using something like we're using now, Teams or Zoom, to do an evaluation or talk with collateral sources or whatever. And so I like, again, I'm American, so I tend to have a stronger familiarity with information the American Psychological Association has put out. And in 2013, they established guidelines for the practice of telepsychology in a general sense. And their definition includes a lot of different types of telecommunication technology. So in addition to video conferencing, you may not think of phone or email or chat rooms or even just the use of the internet and social media as being part of telepsychology. But according to this definition, all of those kinds of interactions, whether they're synchronous or asynchronous, fall under this definition. The Australian Psychological Society also talks about technology, but they do tend to focus their discussion on video conferencing more specifically. But I'd like to try to expand we'll talk a little bit about video conferencing issues, but I'd like to expand our discussion a bit to talk more broadly about some other types of technological applications. So these are the objectives for today. And again, I know we don't have a ton of time. And so really the goal for today is to bring some awareness to new and emerging research and resources related to technology in this area, to try to emphasize some areas of continued development. So where do we need more research, or where are we stuck? And like I said before, to kind of expand the discussion of technological applications beyond video conferencing, although we will spend some time talking about that. And then hopefully to showcase some other initiatives that are going on in the practice of forensic mental health. So again, there's a lot of stuff to cover in the time that we have. So I'm really going to kind of scratch the surface of a lot of these things. This slide depicts, I don't know if folks are familiar with the sequential intercept model, but it's basically this model showing different intercepts along somebody's involvement in the criminal legal system where we can apply intervention. So intercept 0 would be more like preventative kinds of community services, like maybe services to stop the school to prison pipeline, things like that. And technology can be applied anywhere along these various intercepts. And actually within law enforcement, there's a lot of advancements in technology being applied here, like computer surveillance, using AI training for law enforcement to kind of give them some more realistic scenarios to work through in practice that don't expose them to danger. There's also like some technology on crime prediction using AI and machine learning kind of technologies to predict where crime is most likely to occur in certain neighborhoods, although there's a lot of discussion about the potential for racial bias in using those kinds of tools. So law enforcement is a big area where technology can be applied, but we're going to focus this discussion mostly on the back end of things. So pretrial issues, post disposition, so post sentencing, detention, reentry, and even some potential applications for community corrections as well. So as I said, we do kind of tend to focus a lot of the literature currently on video conferencing, particularly in forensic mental health evaluation. So I want to give a little bit of time to talk about that and where we are with that kind of research. I know we tend to think about technological applications and particularly video conferencing as a post-COVID thing that we were doing. We sort of had to jump on the bandwagon of using video conferencing to do these kinds of evaluations because otherwise people were not going to get through their trial process, or they're going to sit around waiting for services because we can't really see them in person. But these kinds of services were increasing well before the pandemic. I mentioned earlier that the APA had guidelines back in 2013. We had in the US, we had guidelines from the American Telemedicine Association. Our American Psychiatric Association also had guidelines. And there's a lot of focus on using, again, particularly video conferencing for mental health services, especially in rural and more difficult to reach areas, or areas that didn't have a lot of providers available for that reason, to increase accessibility, increase cost effectiveness, and really get people connected with services. So this is one of my favorite articles that I like to talk about when I talk about these things. This is a paper that came out in 2013, and did something just happen?
Yeah, your slides just flicked off and now they seem to be back but loading. They've gone back to the start.
Okay.
Can you see them still?
I can. It just like switched formats. Okay, hang on. Let me get it. You know what I think happened? So I was playing
your
around.
slides just loaded.
I think they loaded like they were supposed to. Okay,
Yeah.
wonderful.
Well,
Give
that's
me
good news for
1
you.
second. Okay, that's where we were, right?
Yes.
Okay. Sorry, all of a sudden something like my screen totally changed. I was like, what the heck happened? Okay. All right, back to this 2013 study. So I just think this is such an interesting study. So back in 2012, they surveyed a bunch of psychologists and asked them what they thought were going to be kind of the biggest things in mental health in the next decade, right? And so they're predicting what's going to be the biggest thing in 2022. And the forecast prediction was that the expansion of telepsychology was expected to be the biggest thing coming in the next 10 years, which I think is kind of interesting. I mean, I'm sure these people didn't have a crystal ball or anything and knew that there was a pandemic coming, but just to think about that, where people were in 2012 and thinking to the future of this kind of technology. And the Australian Psychological Association also had similar sentiment around how effective telehealth and video conferencing type services would really be. And this was an invited commentary where the conclusion was technology is the key to solving mental health care access problems in the 21st century. So they really they were putting a lot of weight. This one came out in 2015. They were really putting a lot of weight on technology to sort of solve these problems across the globe in terms of mental health access shortages. So in the general mental health context, that people were moving forward relatively quickly with teleservices. But I would say that forensics moved a bit slower in terms of its acceptability of all of these things. So even, especially pre-pandemic forensic work, and I would say even after the onset of COVID, people were pretty vocally concerned about how well it would hold up in court, whether they would be challenged, whether they might miss information that's really important or central to the psycholegal questions would be lost. And there just seemed to be a lot of pushback. And I encountered this sort of anecdotally myself in just talking to colleagues and peers and things like that, early on in my career when I started looking at these things. And I tended to have a more positive outlook on the use of technology than some other people did at the time, right? And so if you remember what happened after COVID, there was probably a lot of discussion about how we now do things. What is the new norm in terms of providing forensic mental health services? So obviously there were some exceptions to that attitude of resistance. Here's an example of some folks out of forensic care who published a commentary paper back in 2008, where they were talking about how useful video conferencing technologies could be to forensic mental health services here in Australia. But the practice of remote services was pretty sparse at the time, and so was the literature. We didn't know too much about how effective or not it was compared to in-person services. So a lot of the research, even today, focuses on clinician practices, better understanding the frequency of use, and also what practitioners' opinions are about using things like video conferencing. So I'm going to just briefly summarize the trajectory of literature in this respect. So in pre-COVID times, my research team and I did, I think what was the only, or maybe the first, I don't know, we did a survey of forensic clinicians, and we basically asked them, have you ever used a video conferencing for a forensic evaluation? If you have, what are your thoughts about it? Have you, what particular types of legal questions have you addressed with video conferencing? Do you see any issues with ethical use or legal concerns or anything like that? So in terms of the frequency, we found that about 35% of clinicians were using video conferencing. And I have another study, the Bernhard study came out after COVID, but they asked clinicians kind of retrospectively to report on whether they had used video conferencing before the pandemic. And their estimate was that 55% of people said they had used it beforehand, although I think that might have been just some memory problems. But so our estimate was much lower than theirs. And then there were a couple of surveys that came out right after COVID, showing that obviously that usage increased to about 60 to upwards of 90% of people now using video conferencing. And there was a similar survey of forensic clinicians that was published last year, and now the usage rate is almost 100% of people who were surveyed had done a video conference evaluation. Just to kind of show you how far behind we were in forensics, this is a study in 2016 that came out on behavioral health professionals in general. And so at the time, they reported over 70% usage among the people who responded to this survey. So if you compare that to the 35 or even the generous 55% from the Bernhard study, we were pretty far behind in terms of where other types of professionals were. And then a lot of those surveys, like I said, ours included, looked at perceptions of clinician use. And again, this is sort of a cursory summary of the progression of that specific literature. So when we did our survey in 2019, most people weren't that thrilled about using video conferencing, except for the people who had said they had used it before. So that 35% of people who said, yeah, we've done it, those people didn't really seem to have much of an issue with it. They found it to be pretty comparable to in person, but it was the people who hadn't used it before who kind of poo-pooed it and didn't think it was a good idea. And then again, some of those surveys that came out during COVID, people were still expressing some concerns, but the attitude was, we don't really have a choice, in doing this if we want to keep our practice going and get people moving through the system. And then that study that came out, or the survey that came out last year, found, I'm going to read you something that I pulled directly from their abstract. They said a striking 43.7% of respondents, that should be 73% of respondents preferred video conferencing to in-person evaluations, and another subset of those respondents said that they had no preference over the modality. And then most people also reported that there weren't any forensic mental health issues for which they would not use video conferencing. So again, we kind of went from people not really being that favorable to it to now we sort of like it better than having to go out or having to, get fully dressed and go out and do our evaluations. Okay, this is from our 2019 study, just highlighting some of the main concerns that people tended to express about this type of technology. So sort of the typical things that you might expect, inability to administer measures, technical difficulties, maybe some loss of behavioral data. And I'll note that study 1 in this case were forensic practitioners, whereas study 2 were attorneys. Attorneys don't like to respond to surveys, so we only had 27 attorneys represented in this particular study. So these are kind of the typical barriers that you might expect, but whether those are actual barriers and to what extent they are issues above and beyond traditional in-person evaluations is not really that clear. We don't have a great understanding about that. So what do we know about actual outcomes, right? We can ask forensic evaluators and clinicians what they think and how they practice, but is there actually any difference in terms of the outcomes that you get from an evaluation done through video conferencing? This was a meta-analysis that I did with some colleagues that also came out before the pandemic in 2015. And there wasn't a lot of research at the time. So our meta-analysis was quite small. We only had 5 studies in that we were able to meta-analyze. We had a number of studies that we could um, review and summarize. But in terms of the actual number of studies that met our inclusionary criteria for analysis, we only had 5. But of those 5 that we analyzed, our results suggested that the telepsychological outcomes were at least comparable to in-person outcomes. So that was pretty good news. And I want to quickly review 2 studies that were part of that meta-analysis that I think have particular relevance. So one is a study by Fran Lexon and colleagues where in the US, we call this competency to stand trial. I think it's a fitness to proceed or fitness to stand trial. So this was done in that kind of context using a couple different, they used the MCAT scale here, looking at understanding, reasoning, appreciation. And they had a couple different conditions here. So the local remote one is essentially saying that one practitioner was seeing the person locally in the room with the person being examined, and then there was a second observer who was completing these forms remotely. Okay, so we had a local remote, a remote local, and then we had one where they were both essentially in person. And so you can see a few variations in the correlation there, but generally there wasn't a big difference in how people were rated, whether or not they were in person with the examinee or not. This was another similar one. Gina Mancuno-Mir and her colleagues did a similar type of study with the Georgia Court Competency Tool. And you can see, so in the telemedicine condition, it was very similar. One person was through, observing and rating the form through telehealth, and the other person was in the room with the person being examined. And then in the live interview, they were both of the examiners were in the room with the individual. And again, they had pretty high correlation in terms of their agreement as to whether the person was competent or not, or unfit or not fit. It was kind of interesting from this study. They found that the providers preferred in person, despite the fact that there was pretty good reliability, regardless of how people were evaluated. But the patients themselves had no real preference at all. It was the providers who were the most skeptical. So another area related, we're going to move on from video conferencing type issues now, but another area that is related to forensic assessment that's emerging in terms of technology use is in the prediction of violence risk. So I'm going to kind of talk about this somewhat quickly again, because one, we don't have a ton of time, and two, it's a very emerging area, and it's also one that I think is a bit controversial in the grand scheme of things. So we'll just talk a little bit about this again, just to bring some awareness to this particular area in which technology is being applied. So machine learning is the main form of technology being applied to violence risk prediction. And essentially machine learning uses, again, I'm not an expert in this particular area, but at a very foundational level, machine learning is the use of computer generated algorithms, right? Basically a learned pattern based on available data to predict some kind of outcome. So an ML classification problem might present discrete risk classifications, and based on a bunch of information about an individual might rate them as low risk, low, medium, or high risk. I should say that information is not just based on the individual, but based on a large database of individuals who offended or didn't offend, or whatever the outcome is. So in violence risk, it's essentially taking these static and dynamic factors from, like I said, many known cases. And then those are used to predict an individual person's risk classification. Again, typically using a categorical approach like low, medium, high risk. And really the intention is to improve accuracy, objectivity, and transparency, and hopefully reliability in forensic clinical decisions, right? We probably talk a lot about how we as human beings and forensic practitioners, we're not as bias-free as we like to think we are. And so this is an effort to try to minimize that kind of human error that can interfere with the ability to better predict violence risk. So like I said, there's really not a ton of research on this area yet. It's really quite new, but there has been it's kind of like our meta-analysis that I was talking about earlier, an attempt to systematically review what is available in terms of machine learning as a violence risk prediction tool. So this study that was published, I don't have the date on here, but I think it was 2021 maybe, and they reviewed 8 studies. And within this review, they essentially concluded that machine learning generally outperformed structured violence risk assessment instruments in predicting violent episodes. So it was better than the regular way that we tend to do things. But the caveat that these authors put out was that there was a high level of variability in the experimental procedures, specific outcomes, and the sample characteristics. So it's still a bit unclear as to how much better machine learning might be than our typical ways of assessing violence risk. There's also been the question of whether machine learning leads to bias itself, right? So we can be biased as human beings, but is machine learning any less biased in that respect? And the answer obviously is, possibly. Anytime you introduce anything new, there's an opportunity for bias. So this was a study that was done in Spain, also published around 2021. And they found that while the machine learning model, this was in the context of youth prediction. And so they had a bunch of youth cases, and the ML model achieved higher predictive power than the SABRI, which is a typical tool to assess violence risk among youth. But the ML model also showed some gender and ethnic disparities. So the ML model, the machine learning model, more often incorrectly classified men and what they were calling foreign nationals, basically anybody not born or from Spain, as recidivists. So there was some bias. It was better, but it also introduced more bias into the picture. So there's, of course, this potential for these sorts of things to become problematic. So it's been argued as well that inequality of base rates, particularly, within offending populations, might explain some of those disparities. So if something is happening more often within a certain population, so for example, if offending is occurring more often with men or foreign nationals, as they were talking about in the Spain study, then that machine learning algorithm is going to pick up that pattern and maybe end up adding bias to the prediction, right? So I don't know. I mean, there's kind of some ups and downs with machine learning, or maybe machine learning is, maybe it's more amenable to being perfected versus our human judgment. I don't know. I'm not saying that's necessarily my opinion on things, but just something to chew on and think about a little bit. And then, another question here is really, is the bias that is introduced by these measures better or worse than the bias that we contribute when we're doing these sort of things? This is another just kind of a general overview talking about some of the implications of using AI tools like machine learning for violence risk assessment. So if anybody is interested in learning more about that, or kind of having learning a better sense of what people are cautioning uh, practitioners about when it comes to using these kinds of things, this would be a good resource to use. As far as forensic assessment goes, we do have a lot of research, I think, that we can and should be expanding upon. So, we've got some surveys of forensic practitioner use and perceptions, and we had a few studies looking at assessment reliability. But if you remember the dates, right, one was from 2006, the other one was from 2007. I know of people working on other kinds of research related to reliability and comparing outcomes across in-person and video conference evaluations, for example. But there's not a lot of that published yet. So these are just some other thoughts, particularly if anybody out there is a researcher and wants to look further into these kinds of things. We could use perception, more work on perceptions and experiences using telepractice in different contexts. I think we kind of have enough from the clinician side of things, but we could learn more about what actual people being evaluated think of these services. What do judges think? What do attorneys think about this? I had some former students who were looking at issues related to expert credibility and what is if you testify virtually, does that impact you in some way? Or if you have done a virtual evaluation, does that impact your credibility? Like, do they think, maybe, oh, if they couldn't get to see that person in person, then that must mean that they don't care as much, or, whatever. So we've looked into some of those things. And like I said, looking at whether telepractice leads to differential outcomes, like if I do a pre-sentencing evaluation through video conferencing, does that kind of lead to differential decisions than if I had done it in person? Looking at differences in standards of practice, how do people actually handle these things in their reports? What are they taught? How much information do they include when they're doing a video conferencing evaluation? Do they include information in any sort of consent forms or anything like that? What are kind of the standards of practice for practitioners? We have some general guidelines out there, but what are practitioners actually doing in their practice? We also need a lot more studies looking at cultural factors, again, to kind of prevent some of these potential biases that may occur when technology is used for assessment purposes. And just in general, we need more studies that have larger and more diverse samples. This is an example of a study that it's more in like a medical legal context. So this is looking at the differences between telehealth and in-person evaluations for disability claims among veterans. And so this is the kind of research that we need more of in our area. So again, the Lexan, the Manguno Mirror studies that I was telling you before, I mean, those were done, almost 20 years ago now, and they're still the only known randomized studies looking at the reliability of remote versus in-person competency testing, right? And so this particular study was looking at differences in the report content, the quality of the reports, what people were actually reporting, and whether those evaluations actually led to different disability outcomes for these veterans. So I show this just as an example of some of the type of work that we still need to be doing with respect to assessment. And as I said, this is kind of my personal opinion, but I really don't think that we need any more surveys of forensic examiners at this point. Again, other types of professionals that are involved, like attorneys, judges, the defendants, looking at their views about the validity of an assessment, quality of services that they're getting, whether, judges feel that there's any kind of barriers to admissibility in court, things like that. But I think we can probably leave the examiners alone for now. I want to Since I have a few minutes left, I want to talk a little bit about the other side of things. So in addition to assessment, technology is being applied more regularly in the rehabilitation and management of correctional populations, which is kind of more where the population is of particular interest to me. So we're seeing a rise, again, beyond technology for evaluation type purposes, we're seeing a rise in digital tech for rehabilitation. So things like in-cell tablet computers, using mobile applications, interactive gaming, web-based programs, or virtual or augmented reality, right? So VR is intended to stimulate a more essentially detail-rich and immersive experience that for this population is really, I think, useful because we're trying to teach them to make better decisions and not to engage in behaviors that are dangerous or high risk. And so we can allow them to kind of play out certain types of scenarios in a way that doesn't allow for any real harm to take place. I wanted to show you just an example of how this kind of technology is being pushed within Australia. So this is um, a overview of a strategic plan that was put out by New South Wales. And when you see R&D, that's talking about research and development. So they've got these different areas of technology development that they are wanting to expand on for, again, rehabilitative purposes. And they actually, a few months ago or later last year, they put out a call for external researchers to submit proposals so that they could work towards some of these goals with external researchers. So I thought it was a really good example of how this stuff is being promoted within the country. This is another, I was just doing some Google searching to see what people were doing and how these kinds of things were being talked about. And I came across this website here where they were talking about an international effort across multiple countries in Europe, and they're reporting kind of generally positive feedback in pilot testing of programs designed for education rehabilitative purposes that are based in VR technology and VR training. This is a portion from the United Nations website, just to, again, kind of emphasize the global level in which these kinds of issues are being discussed. And so this was part of a United Nations effort to put together a report on technological uses in digital rehabilitation for correctional management and correctional reentry. And education. So even the UN is kind of picking up on these things. And I know I've had an opportunity to meet a colleague who's at the University of Melbourne who had a role in drafting this report. So I believe the report itself is coming out shortly. This is an article to illustrate the fact that this kind of technology for correctional populations is really not a new discussion. So if you see the date of this one is from 2011, and they're talking in this article again about virtual reality and how it might present new possibilities and new opportunities for research, training, and rehabilitation within criminal justice. So these things have been talked about for quite a while. I think I'm probably going to skip this video, but if you're interested in seeing what this actually can look like in practice, just go on YouTube and Google virtual reality in prison. And what will pop up is a video from, this is actually from a prison in Colorado in the States, which you don't really think of us as being very progressive in these sorts of things. But this is there's a couple different clips. There's one from Vice and there's one from BBC, but they're all talking about this program in particular, and you can kind of see them putting these goggles on, and you can see what they're looking at, and they're learning how to, order at a restaurant. They're learning how to talk with an employer who asks about their criminal history and how they can navigate those kinds of situations in a more, virtual reality is, the avatars are vary in terms of how realistic they actually appear. But a lot of a point that they make in this video is that a lot of these guys have been in prison for a really, really long time, and they haven't. Thanks, Marie. Thanks for putting the clip up there. And they may not have seen the inside of a grocery store or a restaurant or, whatever in many years. And so and then the clip kind of ends with one guy talking about, I should have probably just showed it as much as I'm explaining this clip. I could have just let you watch it. But anyway, he says at the end, like seeing the virtual reality space, it gives him hope and realizing like, okay, I'm going to be out there soon, and I'm going to see something other than the walls that I see in here every day. So anyway, I would really encourage you to take a few minutes to watch this clipping. You can really see how those kind of programs can be used.
Any of these?
Oops. Just showing you a couple other types of articles out there on the use of VR. This one I thought was interesting because it talks about actually getting the thoughts and opinions of, in this case, they're looking at women who are incarcerated and kind of getting their perceptions on what would be effective in terms of development, as far as developing virtual reality for therapeutic purposes. So, it's really emphasizing the need to include incarcerated people in the actual development and design of virtual reality. So the question probably is like, are these programs actually effective? Can VR, really impact reentry or reoffending rates? And again, it's an emerging area. So all we can really say at this point is that it's promising. This is a study that, again, looked at VR among men convicted of domestic violence offenses. And so in this, I just thought this was such an interesting study as well. The participants were immersed in a full body ownership illusion, right? And so in the virtual reality scenario, their avatar appeared as a woman. So they were essentially immersed in this life-sized virtual woman's body that moved synchronously with their own movements. And following the VR simulation, the researchers found that the men were better able to identify fearful faces on women, and they were less likely to misidentify fear as, another emotion or a more positive emotion, right? So it's kind of an interesting study looking at these changes in, I don't know, maybe emotional awareness or emotional, empathy of other people. But the question really is, does it actually work to reduce cases of domestic violence, right? So they didn't look at whether, these men who participated actually refrained from engaging in further violence against women. This is another VR study that I'll kind of skip over, but this one looked at the use of VR in forensic inpatients and trying to reduce aggressive behavior. And they found that they were able to, the VR participants who went through the VR program, they had more shorter term impacts in their anger control skills, impulsivity, feelings of hostility, but that the maintenance effects weren't as good. And so again, it's, maybe promising, but there needs to be more work done here. So I think that a study like this could be potentially used to argue that it's not worth pursuing virtual reality in this kind of way, but it could also, again, just mean that we need more improved technology, or maybe that the underlying content of the intervention needs to be improved rather than just throwing out the whole idea of using virtual reality for these kinds of purposes. So to kind of speak to that point, this is what a virtual reality interaction might look like. Again, having somebody go through an interaction at the grocery store, right? And so, the point of VR is that it's supposed to be immersive, and it's supposed to make participants feel like they're truly present in the situation. So depending on the quality of the virtual reality, maybe it doesn't outperform, a standard role play exercise that we might do with somebody. So, looking at this image here, right? Does that feel real? Is there enough realness coming from this particular image to actually have an impact above and beyond our, like I said, our standard way of teaching people these skills. This is just one talking about how they use virtual reality to train prison guards, and how, again, similar to the law enforcement issue that I was talking about earlier, can we train correctional officers to be more prepared to address higher, more serious instances of misconduct and things like that without actually exposing them to the harms of those situations, which could potentially have some positive consequences for staff turnover and well-being, just to have more preparedness in dealing with these things. And maybe those kinds of trainings could also translate to mental health issues as well, like training staff to intervene and de-escalate in a more therapeutic way. So maybe some of these VR tools could be used from this training perspective as well. So let's see. I know I only have a few more minutes left before we want to open it up for questions. I liked this quote. This is from the Monitor on Psychology, which is a magazine that is published by the American Psychological Association, and they were talking about AI tools and essentially this kind of controversy of, is it a good thing, is it a bad thing, how do we kind of get prepared for this? And I liked this particular psychologist's way of putting this, right? So they acknowledging that there are some complex trade-offs, particularly in AI. Again, that's sort of the area where people are getting the most nervous as far as like applying technology to mental health, or specifically our type of work. And they recognize that it's not going to be all good or all bad, right? But I think we as psychologists or other professionals, psychiatrists, lawyers, social workers, whoever you are, you have the capacity to weigh those trade-offs, right? So, they're basically saying that we have the skills, we're ready to kind of meet the challenge of applying technology in different ways. And really the bottom line is we can't stop this kind of stuff from coming, because it's pretty much already here. So the questions, I think, become, how do we leverage it to our advantage and to the advantage of the people in the criminal justice system and the public? And how can we kind of come together as a professional community to make sure that the bad parts of it stay out, or that we stay on top of that, and again, use it for good. Let's see. I guess I'm going to skip ahead just a little bit and point to a couple things. So one thing for me in getting interested in this area, I'm not a tech person. I'm not technologically savvy myself. So don't think that you have to have a lot of tech savvy to be able to do some of these things. And I think one of the best ways to get more comfortable about using technology, or even thinking about how to use technology, is to start building some of the tech into your everyday practice. And again, if there's an opportunity that I can share these slides, or people want these slides, I'm happy to send them. But these are just some kind of fun AI generated tools that I think are particularly helpful for forensic context, or for those of you out there doing research. SlideSpeak, for example, you can put I uploaded an old presentation of mine, and I asked it, what is this presentation about, and who did this presentation, and what was the bottom line of this presentation, or things like doc analysis, where maybe you don't have time to review an entire case law, or you don't have, this is a 59-page court opinion on a case, and I figured out who the defendant was, I figured out what the opinion was, I figured out what the evidence for the opinion was in a matter of maybe like 30 seconds. So some of these tools I think are really helpful for just everyday practice, and kind of gets you just in the mindset of how you can use these things make your life a little bit better, more efficient. So definitely skipped through a few things here, but again, here's my contact if anybody has questions or you're just particularly interested in this area or you have ideas or whatever it is. I'm happy to engage.
Thanks very much, Ashley. A really interesting talk. Just a reminder to pop any questions that you have in the chat. While that's happening, I did have a couple of questions. You mentioned a couple of times that this is kind of the idea of using technology, and particularly beyond video conferencing, is not a new idea, and that, you know, it's been part of the kind of conversation in the background well before COVID. And I was curious as to what you see as, given that, what are the barriers and why aren't we seeing that kind of being used more? And also just whether you're aware, and it might be a bit of a tough question being a recent traveller to Australia, but are you seeing any of that kind of space opening up in Australian correction systems beyond that strategy from the New South Wales government?
Yeah. Yeah. And I think they're a little bit like I've heard some mixed not opinions, but mixed news on where they are with that particular call. But it's the only, I haven't seen, maybe other people have seen things, but New South Wales is the only place that I've really seen such a big and public push for these kinds of things. And I know just in talking to some colleagues who are a bit more connected with them and what they're doing, that they've put, for example, tablet computers in everybody's cell. And now they're kind of just figuring out, what do we do with these tablet computers? What should we put on them? You know, how do we make the best use of those kinds of things? I would love for Victoria to start thinking about some of these ways that we can, you know, maybe add to or enhance the kind of programming that's being delivered to corrections populations, in particular forensic mental health populations that are incarcerated. And then I think the second part of your question is about barriers. Is that right?
Yeah.
Yeah. Yeah, there definitely are. And I had a couple slides about, you know, challenges and precautions that I didn't get to because I was rambling about other things. But, you know, there's definitely, obviously there are, you know, challenges. There's potential for misuse for technology. One of the barriers that I've encountered personally is that, you know, I'm a researcher. I enjoy researching these types of things, but sometimes the technology moves faster than the research can occur or happen, especially with like AI types of tools or mobile apps or things like that. You know, we don't always, the scientific research tends to progress more slowly than the technology advances. And even with video conferencing, I mean, we were, well, at least in the general mental health realm of things, people were using it much more. The rate at which it was being used and the prevalence of use completely outweighed, you know, what research was available to support it. I mean, the research that was available was generally optimistic, but it wasn't, you know, people were just using it without having a ton of a research support around it. Obviously, tech also costs money. Especially on the front end of things when you're buying equipment and you need to figure out how to pay for updates and upgrades and things like that. So like New South, I don't know how they're funding tablets for everybody. I don't know. I gave a similar talk like this to an American audience, and they were like, well, where do we get money for that? And I'm like, you know, honestly, I don't know. I mean, you can get grants and things like that, but then what happens when the grant goes out? So I don't know. They must have budgeted money for those kinds of things to do that. People have also, there's another researcher in the Netherlands, Hanneke Kip, who does a lot of the VR and mobile app kind of work. And, you know, she's talked a bit about some of the barriers in like development being too heavy on the technology side and less focused on the human side of things, that we can build these really cool things, but making sure that they are easily, that people can use them easily, especially, when you think about corrections populations, they may not have had, a lot of experience with technology or using different types of devices or things like that. And so we need to think a bit more about how these things actually get used. And I was talking to a colleague not too long ago about this as well, but, talking about the engagement piece of things, that you can't just make an app or what, or if you think about like wearables that you or something like Duolingo, right? What keeps you motivated to keep logging in and to keep doing, I think with Duolingo, I don't use Duolingo, but I think it's because the owl is kind of aggressive, and that's why people, do it, because they don't want the bird to yell at them. But, so that's a really important piece, is how do you actually get people to come back and do it? Maybe, in criminal justice, maybe it's part of mandated programming or something like that. But, getting people, it's not enough to build the technology, but you have to actually think about the implementation and the ongoing use of it.
And need the buy-in, I guess, and like you said before, the funding to support that implementation.
Right.
It'll be really interesting to see what comes of that New South Wales call, and if all of those proposals have gone in, and how many of those are actually funded, or how they're planning to fund them, and what develops from there.
Yeah, I'm really interested to see it too. Yeah, I got here right as the call was kind of closing, so I was a little disappointed. I'm like, I know what you can put on those tablets. I have ideas.
Well, if there aren't any further questions, I just have everybody put a virtual hands together for Ashley for her presentation today. Thank everybody for coming and attending as well. Shortly, you'll be receiving just a very short feedback survey. If you could take a couple of minutes to fill that out, just to let us know how you found today's session, that will be greatly appreciated. And sign up to our mailing list to learn about future CFBS Seminar Series sessions. And we hopefully will see you next time. Thank you very much, everybody.
Thank you.